I hope you've been enjoying the conference so far and balancing all the great content we've been getting with some breaks to take care of yourself. Given all that's unfolded in the last several months, we want to talk now about how the pandemic has impacted the workplace and worker mental health. I know it sure has for us at MHA, even trying to pull together a conference like this on relatively short notice for all of you puts us all under a lot of stress. So many of us, like me, are still working from home, and employers around the country and globe are adjusting to a new normal, remote work, hybrid models, and some, of course, with essential employees who have to be on site. And we're probably never going to go back exactly to the way things used to be before COVID-19. Workplace wellness, including workplace mental wellness, is nothing new to MHA. In fact, we've been working in this space for 40 years now. And at the start of 2020, we launched the Bell Seal for Workplace Mental Health, a certification program to recognize employers who are committed to creating mentally healthy workplaces, no matter what their employees are expected to do in their jobs. The Bell Seal program is open to any employer in the nation, no matter how big or small. And I'll encourage you to look at this at the end of this conversation that we have. But we thought it would be a timely and appropriate conversation to have today as we all navigate what it means to have a mentally healthier workplace in a COVID-19 world, to sit down with one employer that's received our highest level certification this year, Platinum. We want to talk about workplace wellness and how recent events are putting an even finer focus on the need for having policies and practices in place that support employee mental health and well-being. So I'm pleased to be joined now by Dr. Matt Collins, their Executive Vice President and Chief Medical Officer of the Platinum Blue Seal recipient, Blue Cross Blue Shield of Rhode Island. Before joining Blue Cross in 2015 as Vice President of Clinical Integration, Dr. Collins served as Senior Director of Medical Affairs at Fallon Community Health Plan in Massachusetts, and was the Medical Director of Neighborhood Health Plan, also in Massachusetts. Matt brings to his role a unique background as both a family physician and medical director with deep understanding of how to manage the quality, experience, and performance of behavioral health networks through health plans. He's also passionate about designing and implementing care models across diverse populations. And as Chief Medical Officer, Matt has comprehensive oversight for medical management, including care management, utilization management, and behavioral health management, all with the goal of ensuring that Blue Cross Blue Shield members get the right care at the right time in the right setting. Matt also leads efforts to control the increase of total medical expenses. Matt, welcome. Thank you for joining us today.
Thanks a lot, Paul. It's great to be with you and invited to your organization's annual meeting.
Yeah, we're so glad to have you here, especially to talk about this subject that really has been on everybody's minds for the past 6 months. How do we do this? And so maybe we just start by, generally talking about why workplace mental health matters. It obviously matters to Blue Cross Blue Shield Rhode Island, but why should it matter to everybody?
Well, from a very basic standpoint, and concretely, it matters because, emotional well-being for the whole family of folks who support an employee, it contributes to greater productivity. But that almost sounds like, just too concrete. It doesn't just start to do, workplace wellness overnight. This goes way back to our commitment that Blue Cross and Blue Shield made, a long time ago to make sure that, we were providing everything that we could to our own employees and to their families in terms of benefits and other offerings that would help to contribute to their well-being. We're a health care company. A lot of folks don't think of health insurers as a healthcare company, but we are. And in a lot of ways that we actually are delivering care through our care managers and indirectly through the things that we support, initiatives that we support. So we think a lot about how do we keep our own employees and those of people that we're insuring well. And so it really goes into kind of a deeper, dive into, how do we really make sure that we're doing everything from an employer standpoint to create a healthy workplace.
So how big is Blue Cross Blue Shield of Rhode Island? We've got employers of all sizes and people working for employers of all sizes here looking and watching us, but just tell us a little about that organization.
Blue Cross and Blue Shield of Rhode Island is one of the 39 member Blue Cross plans. We are, our business is Rhode Island, and as people know, one of the smallest states in the nation, with a citizenry of about 1 million people. And we insure about 440,000 of those folks. And our lines of business include commercial and Medicare. And we have a Medicaid market in Rhode Island. But we have a presence here, and we want to keep growing. We've diversified a bit in some ways, and we've created a mission to actually develop some primary care centers in Rhode Island, for which there are 3 and soon to be 4. We also have a presence in the community in retail sites we call Your Blue Stores, where we offer programming, things like yoga classes, cooking classes, mental health related classes such as meditation and mindfulness training. And it's also a place where people can come just for general service center kind of needs, like paying a bill or finding out more about their benefits and stuff. So we're pretty big in a little state.
Yeah, and it sounds like you've got a diverse workforce in the sense that you've got some frontline people who are basically interacting with the public on a regular basis, all the way to, to back office people who are handling things in environments that may be more flexible or get more flexibility. So is that fair? You've got to think about really all kinds of in employee circumstances when you're developing your employee wellness and mental wellness programs.
Yeah, that's right, because there are a lot of stressful positions for various reasons. Those the frontline folks who are interacting with the public either through telephone or in person, and that's been particularly stressful now as there's been a lot of work from home, and but some have returned, and such as to the retail sites, and there's certainly other pressures. I mean, it is a competitive business, so there are ways in which there's lots of pressure put on different people in the organization, whether they're in finance or they're in my area, which is medical management, or they're in contracting and whatnot. So, that combined with living and now working in the home is definitely added a new layer of stress.
So what do you do basically to help folks manage that stress? I mean, again, you've had programs in place since before the pandemic. I don't know,
Right.
have you doubled down on some of these? Have some become more important than others? I mean, what are some of the ones that you think have been most important in helping your own employees within Blue Cross Blue Shield Rhode Island, or you yourself?
Right. Well, as you mentioned, going back, this is nothing new for us. So we, for instance, introduced mental health first aid training, which a lot of our associates or employees availed themselves of, just to start from a basic level of understanding of when do you recognize stress in yourself or in others. We also became a partner organization in the change direction movement, which is in another way in which people that, set a basic level of understanding of when do you recognize stress and strain in the workplace and individuals and whatnot. There were other programming that we've offered live and virtual even before the pandemic, such as mindfulness training. We have an on-site gym in which we once a week would have a mindfulness experience for folks to drop in during their lunch break. We have also now shifted some of that to online, and we're using Facebook Live for some mindfulness and also some yoga training. There have been a lot of other things as well that we've been doing over the time period that really kind of get to our vision statement. Is if we're trying to create a state of health and well-being for all of Rhode Island, we have to start at home in a way, and meaning with our own associates.
So why do you think then that it would have been important for Blue Cross Blue Shield of Rhode Island to apply for, Mental Health America Bell Seal? I mean, you were doing all of this anyway, and why do you think it is that the organization said, yeah, we should hold ourselves up this way, and go to this national organization and say, can you evaluate us and certify us this way?
Mm-hmm. There's a lot of reasons. And but some of them are that we set a course led our CEO to really transform the culture of the organization. And one of the things that in measuring our culture objectively, the associates were reporting was there's a sense of fear within the organization, either fear of challenge or fear of failure, and we really had to start to address and eliminate that and become a much less fearful organization. Other reasons were that we live in a state that is beleaguered by a lot of behavioral health problems, not just mental health, but substance use as well. And we have taken great strides to really try to address better as a health insurer, supporting people achieving better mental health and reduce impact of substance use. And we want to be able to measure ourselves against how we're doing. We have a lot of folks point to health plans as the root of evil when it comes to many things in healthcare related, but particularly related to behavioral health in general. And we really have done a lot to try to be a better partner with the community. We see things in the way behavioral healthcare in particular is delivered that could be much better, and we want to be able to help. So applying for this award really helps to measure ourselves and benchmark against obviously other employers, but in a way, and then that's other ways that we measure ourselves. But we wanted to be able to see how we're faring up, both in terms of transforming our culture and being a good citizen employer within our state to help with mental health, achieving better mental health.
So do you think that the pandemic has accelerated the need for employers to take a look at culture and possibly change culture within the workplace? And what do you think about that?
Well, I definitely think it does. You mentioned in the intro the returning to normal. I heard mention by one of the physician leaders in the state, maybe the normal wasn't really a good normal. Maybe we need a different normal. I think we need a different normal in the future, and it certainly has to recognize that humans are biopsychosocial beings, and that one can't just take care of one of those three elements. You have to take care of the whole person. And even just from a very practical standpoint, looking at cost utilization, healthcare cost utilization, as I do and have been doing for the past 11 years, there is a huge, sometimes 2 to 4-fold impact on the cost for folks with a behavioral health condition, any and all. And so if you're not addressing adequately behavioral health in your employed population, and think about them as caregivers of other folks who you may also be insuring indirectly, you're really not doing yourself a good service in terms of your medical expenses. So from that dollars and cents standpoint, it's really necessary, but also, certainly from a productivity standpoint, which isn't really measured at all in cost utilization of healthcare services, you're really going to get better performance out of your individuals if you're contributing to their own wellness. And you have to think as well about the competitive workplace. Now, unemployment is up right now, but it had been at a historic lows. And it's, very easy for folks to jump positions. And so I think creating a workplace environment and conditions and benefits and things that help to address, emotional wellness is even more important now.
When I talk about higher productivity and lower cost, or when we at MHA do that, people say, well, of course, that's what you guys are going to say because you're mental health advocates. But hearing that message come from someone in your position, with your background, your training, and your current position, I hope it resonates with people and rings as true as it is, that tending to employee well-being, including emotional well-being, is the ticket to lower cost, higher productivity, and as you say, a competitive edge.
One thing I just wanted to add, Paul, is since the pandemic and since we had this baseline awareness of the importance of emotional wellness, a lot of our divisions in terms of their meetings, either one-on-one or in groups, have taken to make sure that part of the programming of that meeting or that one-on-one includes just a check-in. How are things going? We've actually had a lot of fun with that, and people sharing pictures about their activities that they're doing at home, pictures of their pets. And there's been, a comfort, obviously, with, a dog barking in the background or a kid yelling in the background or even running up to the camera. We've gotten to know each other much better. And when I've done one-on-ones with folks in my division, which is 100 plus people, I've regularly heard the comment made that they feel so much more connected now than they did before. We've had to be much more thoughtful about keeping connected. But the digital world and the technology combined with the commitment has really helped us to connect better. So I would say that in some ways, the pandemic has allowed us to connect in ways that we didn't consciously do before or do well.
Yeah, that's really important because I know when we built out our office space in Alexandria, Virginia, we made the greatest investment in our kitchen so that we become a gathering place where people informally could check in and just talk about work, but certainly talk about things that were other than work. And I know we and others have struggled sometimes to figure out within the context of the virtual meetings we have how to tend to building the relationships. One of the suggestions that Taylor Adams, who actually manages our Bell Seal program, made early on was that we take time at staff meetings to just take a break and offer some good news about anything that was going on in our lives. And for me, that made such a difference back in March and April, especially, even into May, when we were all just stunned by what was going on, just to take a deep breath and to have people sharing. And we're small staff, but have people sharing 3, 4, 5, 10 people at a time, just something that was going on in their lives that might be totally unrelated to work, that was just from their perspective, good news. We forget that we actually have to do some of those things that when we had everybody captive in the audience, we could naturally do by creating those common spaces. Sounds like you guys have figured that out better than we have and earlier on.
Well, I think you guys, it sounds like a great place to work. I'd love to hang out in your kitchen if I could safely at this point in time. I love Alexandria, Virginia. I went to medical school at Howard University in Washington, D.C., so I have fond memories of that place in many ways. I think that there definitely is a way that we can connect better, and we just have to be more conscious of it and aware of it. And it's certainly better opportunities that presented to us with technology. Now we've gotten much more adept at using it and communicating. There are other things that we've been able to adapt. There's a Microsoft program called Yammer. We've had these Yammer sessions, which are just kind of like a focus session on a topic where people from all over the organization can chime in. So it's really kind of de-stratified our organization because there's these opportunities now to kind of communicate from home. We've obviously had to take a look at some of our benefits in our workplace rules around working from home generally, and we've realized that, geez, there's an awful lot that we can do from home, and by affording that, we can give better time and space for people who are taking care of people at home, whether it's elders or juniors. I think that people have had a better opportunity to remain physically fit, to eat better because they're not so much eating out and eating on the run and whatnot. And we've thought about that and thought about changing jobs so that they can be teleworker jobs. We've given allowances for home office support, I mean, in dollars that people can spend on office equipment for better setup in the home. We've thought more about our responsibility as an employer to help with connectivity issues. We had some of our frontline workers who didn't have home Wi-Fi. And we normally, and before the pandemic, would have sort of said, well, you have to come into work. And now we've said, well, no, they need to be home to be safe. And we need to afford them MiFis, personal hotspots so that they can connect and do their work. So we really have to be thoughtful about how do we, think globally about the whole person and the wellness, as well as, of course, the productivity of the company.
Yeah, so what do we do? I mean, you like us have been able to employ a lot of the, technology and the tools of technology in order to work productively with people scattered about. But what about those sides of your business, which are similar to some others that are like retail and where people really are still in sort of front-facing positions? Have you had to change the level of support or the type of support you're giving to those employees? And are there some lessons there for others who may be frontline workers or attending this conference or family members of essential workers, about, what we're learning about best practice in supporting people who have to be on the front lines?
Mhm. Yeah, so right out of the gate, there were some functions that just had to be done in person. So we still receive payments by check. So for people's premiums and from corporations who are buying insurance from us. So there still had to be some level of people on site. Some things you have to be, even in this day and age, faxed in order to remain compliant with certain rules. And so we had to make sure that we were setting up a workplace where it was safe. So I think it certainly helped that there were doctors, of course, to tap into, myself being one of the primary ones that was tapped into, to make sure that we were following all the right safety guidances. And and I even did a virtual tour one day with some of the employees, meaning I Skyped in and had them walk me around their workplace to make sure everything was safe and secure and they were handling things correctly. And then when it came time to reopen our retail centers, and I should also mention that we have a recreational vehicle that's ready to go to help with any vaccination campaign or any kind of community need. We had to make sure that everything was done to the right specifications. Fortunately, our state issued guidance around retail locations and what needed to be set up, and they're actually conducting inspections, which we passed in flying colors. So we had to make sure that there was the right physical distancing, screening at the door, that the employees were pre-screening before coming to work, et cetera, that there were proper masks present, and so on. So there was definitely a level of that. And I think for the company that doesn't have an MD that they can tap into or another clinical resource, I certainly look to the state public health agencies for guidance. A lot of them have set up hotlines where you can get help. And then, I not to throw my colleague insurers under the bus, perhaps, but pick up your phone and call your insurer. There are doctors there, and there are health experts, and they might be able to help you translate the guidelines into the right plans for your workplace.
Yeah, this is one of the things that, and I don't think you've thrown anybody under the bus there, because this is one of the things that insurers with whom I've spoken, are all thinking about this and are all working on this, because, as you say, I mean, everybody in the health and mental health space really have been thinking in similar ways about the importance of supporting and engaging their employees and also the people they take care of in supporting to support their mental health and behavioral health well-being. So I like it that you said that, because I do think that there are resources for everybody out there, even those who say, well, my state, my governor, my public health department, they're not, talking about this, or they're not doing that, or they're forcing us to do that. There are resources out there. I think that people who want to help make these workplaces healthier and mentally healthier can access. And I appreciate your mentioning that the insurer that people don't often think about that way. They're trying to think about how to avoid, getting contact, having too much contact with my insurer, because that means my costs may be going up. Actually, may find in that a lot of clues and a lot of advice about how to, as you said before, bring down cost and raise productivity as a sidebar.
Yeah, let me just add, and it may be a surprise to your audience, but in my world, in the health insurance world, there is a whole lot more discussion about the importance of full integration of behavioral health and physical health. And a lot of folks are integrating, for instance, their care management. They're really looking more completely at wellness offerings that include attention to mental health and substance use. So it should be fertile ground for most health plans. If they're not ahead of the game, they're trying to catch up in terms of employing new tactics and new partnerships to really get at the total emotional and physical wellness.
Yeah, and you talked earlier, you used the word holistically, and I agree with you. I think that even 5 years ago or 10 years ago, there was not as much holistic thinking across the board. And we've certainly seen it in non-traditional partners. I mean, at MHA, we've certainly had people in the health and mental health space and behavioral health space generally as traditional corporate partners. But We've had so many non-traditional partners come forward and have mental health programs or engage with us, whether it's sports leagues or fashion industry or the fast food industry or gaming, online gaming industry. We're seeing a lot more attention to this holistic kind of thinking. So with that in mind, and with what you said, what's the best way to engage all these differing employers in workplace mental health? If there was one pitch we had to give them as we begin to wrap up this particular interview, what's the best pitch? Is it productivity? Is it cost? Is it competition? Or is it something else?
Well, I think it's all of those things, but it definitely, if your organization is like mine, the CFO controls the budget a lot. And so, making the case from an economic standpoint is important. For the HR area, making the case that it's a highly competitive workplace and to get, the right employees and keep them, you need to offer more comprehensive benefits. There's obviously it goes into as well, maintaining a remote workforce, which we will for the near future. And to be honest with you, like a lot of folks are starting to talk about, like, do I ever need to go back into the office? And do I need to spend money on the rent and upkeep of an office? So remote, even after the pandemic, might be a more common thing. And then be able to maintain connection and a uniform culture in an organization, as well as productivity, is really going to take addressing, the whole person, the biopsychosocial being. So I think it's going to be principally those areas, cost, and definitely, recruitment and retention, and then productivity as well.
Well, thank you, Matt. I just want to say thank you for this important conversation, and for Blue Cross Blue Shield of Rhode Island and all our Bell Seal recipients for leading the way in employee mental health. Appreciated having you with us today. Again, thanks very much for joining us.
It's my pleasure, and best of luck to you and your organization. And we'll be looking to you guys for more award recipients so we can learn from the best.
Well, thank you. If your company is interested in learning more about MHA's Bell Seal for Workplace Mental Health Program, you can visit mhanational.org/best employers. That's mhanational.org/best employers. We'll be right back, so don't go far.